San Francisco's plan to relocate dozens of mental health patients is running into some resistance. Protesters say the city should hire more staff instead of giving up on using empty beds. KPIX5's Melissa Caen has both sides of this dispute. Melissa?
That's right. Here at Zuckerberg San Francisco General Hospital, there are facilities that right now are designated for adult long-term psychiatric care. But today there was a protest by unionized healthcare workers who say that the city should not transition those facilities to short-term care facilities. They say the city should be able to do both.
I've lived here for 15 years.
Donna Mateer is a patient at the adult residential facility at Zuckerberg San Francisco General Hospital. It's an inpatient long-term psychiatric ward with 55 beds, but only 32 of them are filled. And the problem isn't need, the problem is staff.
Since we opened, we've never been full. We've never been able to fully staff. And you can't open vacant beds if you don't have the staff. That's not allowed, nor should it be.
Rachel Kagan is with the San Francisco Department of Public Health.
So it's a very lengthy and laborious process to hire. There is also a shortage of the workforce. So those two things really make it challenging to hire.
So the city has decided to consolidate long-term patients onto one floor and use the remaining space to expand the Hummingbird Place program. That's for short-term care.
People who are on the streets today, who are in danger of harming themselves, who are affecting the quality of life of the public, who are really the city's top priority.
We demand you expand this shelter somewhere else.
Jennifer Esteen is a psychiatric nurse who says the city has enough money to hire people for long-term care instead of just giving up on the empty beds.
$12 million budget, and it's not a staffing shortage only here in this site. So when the city officials say something as disingenuous as we couldn't staff the place, which means now we have to close these beds, it's a bold-faced, well, I don't want to say it's a lie, but what I do want to say is it's irresponsible.
Now, we got a statement from the mayor's office that says she supports, of course, long-term care treatment, and her budgets certainly reflect that, but that the mayor is working with city partners to find more financially feasible ways to support long-term psychiatric care. Live in San Francisco, Melissa Caen, KPIX 5.